Very good morning, everyone. Today we are going to start our program, and as you all know, first we'll start with Common Yoga Protocol, and then at the fag end of the session, today we have a speaker, Dr. K. Sri Krishna. He is the faculty of our Gandhi Naturopathic Medical College. So he is going to speak regarding the acupressure points, which will be helpful in COVID 19, its prevention, mitigation, and rehabilitation. So, now I request our yoga instructors, Girish and Nilma, to start with prayer.
the bombs have been Vishwarati Mokala Venkatani, Mochi Light on the Vajrasana, Dhatu Vidana. Now get ready for Ardha Ustrasana. Turn aside, sidewise, hold the hands of the motion, deep breath, slowly bend back. Ardha Ustrasana. Those who are having knee pain, vertigo problems, please avoid the Ardha Ustrasana, Ustrasana, slowly down. Once again, up and back. Ardha Ustrasana, slowly down. Now get ready for Purna Ustrasana. Now both the hands up. Now raise the right hand up, take it back, and left up. Now complete cover your feet with palms. Rendu అరచేతులతో పాదాలను పూర్తిగా కవర్ చేయాలి. Like an cap, మూత పెట్టినట్టుగా పూర్తిగా పాదాల పైన. That back completely. Ustrasana, thyroid problem, tonsil problem, vocal cord problem, snoring problem. For all these disorders, the best organized Ustrasana. So we have discussed those who are having knee pain, vertigo, problems, which is not performed. Once again, Purna Ustrasana. So down, sit down. Now get ready for Shashankasana. Shashankasana, private posture. Toes together, knees apart. Sit comfort in this position. Move the hands up. Slowly press to the floor. Slide both the hands each time and touch your chin to the knee. Chin to the floor completely. Knees apart in this position. Your hips on knee. Look straight. Gradually, slowly. Head up. Hands down. Once again, hold the hands up. Slowly down. Present. Present. Fingers together. Slowly up. Relax. Now this position by another beautiful asana. Uttana Mandukasana. Uttana means raising. Manduka means cross. A raising cross posture. Uttana Mandukasana. It strengthens the spine. Hold the hands up. Keep on back. Look straight. In this position. Inhalation and exhalation. Deep inhalation, deep exhalation. Observe your spine, back, strengthen your spine, belly portion, eyes, total body, slowly. Once again, up, Uttana Mandukasana. आपको ये ना बाइक मेंटेन जैसे ऊपर उठता है तो बैलेंस से उत्थान Mandukasana, छाती पेट एकदम पेट की नसें स्ट्रेच करते हुए slowly down, relax. Now knees together, get ready for Vakrasana. Move the right leg, keep the head of left knee. Your toes should not exceed the knee. And right hand back, still a little bit back. Press your right knee with left elbow and catch the left ankle. Right ankle. Catch the right ankle. Breathe out. Press it. Maximum press it. Inhale, press. Exhale, back. ఈ కుడి కిక్కని పట్టుకోగలగాలి శ్వాస వదులుతూ inhale back, exhale back, it strengthens the spine, it relieves the back pain and as well as it helps to maintain the diabetes. మధుమేహ వ్యాధికి వీటికి చాలా మంచి ఆసనము వక్రాసన is the preparatory pose for the Arthamanchasana. Relax. Release the left hand, right hand, right leg. Now hold the left leg into the right knee, left with right elbow. Press the left knee towards the face and catch the right ankle. Now catch your face. ఈ ఎడమ పాదాన్ని పట్టుకోవడానికి ప్రయత్నించాలి. ఎడమ పిక్కను పట్టుకోవాలి. కుడి మోచేతితో ఎడమ మోకాళ్ళను పూర్తిగా పుట్టని ప్రెస్ చేస్తూ వెనక్కి శ్వాస వదులుతూ చూడాలి. వక్రాసన. Inhale front. Then exhale back. श्वास छोड़ते हुए पीछे देखना है. वक्रासना. डायबिटीज और बैक पेन के लिए बहुत ही लाभदायक आसन वक्रासन. Inhale front. Relax. Relax in Shavasana. Just relax in Shavasana. Now let's together press the right hand up, coming to the Vakarasana. Weight के बल पर उल्टा लेटना है. Lie down on the stomach. Vakarasana. Toes pointing outside, heels inside. Inhale, exhale. Inhale, exhale. Breathe in, breathe out. Slowly, నెమ్మదిగా శ్వాస పీల్చాలి, వదలాలి. Slow. Now get ready for Ardha Bhujangasana. Legs together, both the palms to the side of face. Inhale up. Concentrate between two eyebrows, Ajna Chakra. Strengthen your lower back, L4, L5, tailbone. Then slowly elbows apart, head down. Once again, up, Ardha Bhujangasana. Down. Now get ready for Sarala Bhujangasana. Both the hands instead of shoulder. So fingers should not exceed the shoulder and slowly up to the Nabhisthana. నాభి వరకు లేపాలి. नाभि నేలకు తగులుతూ నడుము పైకి లేపొద్దు. कमर नहीं उठाना, पेट नीचे नहीं लगना. It strengthens total spine, neck, block Inhale up, parallel bhujangasana. So then go down, relax, relax in Makarasana. Now let's together get ready for Shalabhasana. Ardha Shalabhasana and Purna Shalabhasana. The best asana for the sciatica problem. Now, but those who are having hernia problem, hypertension, cardiac problem, please avoid raising both the legs. Now, raise the right leg 30 degrees straight without bending the knee. Shalabhasana. Slowly down. Your elbows should come completely down to this. మూచేతులు మొత్తం కిందికి వచ్చితే పొట్ట కిందికి. Now, left leg up చక్కగా కదలకుండా నిశ్చలంగా అర్ధ చలవాసన. Once again, right leg up, మోకాలు వంచకుండా చక్కగా మూచేతులు బయటకు కనబడకుండా. Down. Left leg up, down. Now get ready for Purna Shalabhasana. Raise both the legs at a time. Up, best asana. Purna Shalabhasana. Slowly down. Up. Once again, both the legs up. Purna Shalabhasana. Second best from Medicalaga, Gatti Kurugulaga. Up. Slowly down. Relax. Relax in Makarasana. Now legs together. Turn to the right side, coming to the Shavasana. Flatten on back. Shavasana పడుకోవాలి. Shavasana get చేయండి. Now legs together and get ready for Session-1. Pull both the legs, right the ankle, and lift the best portion up. Slowly up. Which strengthen the thighs, of muscles, best portion as well as spine. Gradually down. Once again, up, Session-1. Setu पे लेटा हूँ, ब्रिज लगा हूँ, लेटा हूँ. Slowly down. Once again, up, down. Relax. Shavasana. Get ready for Uttana Padasana. Next to this, in Uttana Padasana, Uttana means raising, Padasana means straight. But those who are having back pain, cardiac problem, hypertension, they should not raise both the legs at a time, one by one leg only. Now raise the right leg 30 degrees, 60 degrees. This is from the Uttana Padasana. Ekapada Uttanasana. Slowly, 30 down. The left leg 30, Padasana. Both the legs at the back. 30, 60, 30, down. Now get ready for Ardha Halasana. Both the legs 30, 60, 90. It's called the Ardha Halasana posture. If you will practice this was 90 angle, you never get the back pain. So 60, 30, down. Once again, Ardha Halasana. Move the legs 30, 60, 90. Maintain the posture. Ardha Halasana. So 60, 30, down. Now get ready for a beautiful asana. Pavana Muktasana. Both the legs 30 degrees. Pull them, exhale, and press them. Remember that while practicing the Pavana Muktasana, while you are exercising, those who are suffering with vertigo problem or neck pain or shoulder pain, even in back pain, don't raise the head, just press the thighs to the stomach. The remaining person slowly head up and touch the forehead to the knee. Like that, like down. Once again, Pavana Muktasana. Both sides. Move them, press them, touch your forehead to the knee. पवन यंत्र की हवा मुक्त यानी श्वास लेना है छोड़ देना है पवन मुक्त श्वास slowly head back leg straight down victory asana pavan mukta asana can be problem concentration visualization creativity all the balance with pavan mukta asana shavasana after this asana shavasana relaxing position while you are practicing shavasana no harm निर्विचार सारे शरीर को शरीर शरीर मन को प्रसन्न रखना है together turn to the right side slowly get up and with the sitting posture get ready for the cleansing process and the pranayama dhyana followed by the pranayama both the hands in chin mudra spine straight neck straight get ready for kapalabhati forceful exhalation in this posture both the exhale 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 deep inhalation one and maximum exhalation. Those who are regular practitioners, they may continue. For the beginners, 20, 20, 23 days. Take a deep breath, relax. Repeat second round, sote jana. Once again, third round, ready for another beautiful asana and pranayama. Anuloma Viloma Pranayama or Nadi Shodhana Pranayama. Left hand in Chin Mudra, right hand in Namasakra Mudra. Index finger and middle finger should be folded. Thumb press on right nostril. Inhale through left nostril. Now close the left nostril with your ring finger. Right out. In, right in. Left out. Beginners 1:1 ratio. Seniors 1:2 ratio. How long do you inhale? Double the time to the exhale. Maintain this Anuloma Viloma Pranayama. Gradually, you can increase the ratio of inhalation and exhalation. You can practice this pranayama 3 times morning, afternoon, evening. Specifically, morning, inhale, begin with left nostril and release with left nostril. Stop with left nostril. Slowly lift out, relax. Now get ready for Sisali pranayama. Sisali pranayama, initially hold the tongue like straw and while inhaling only, synchronize your throat that is called Jala and the bun and exhale through the nostrils. Once on, close the mouth, exhale through the nostrils. Repeat second time. Relax. Sisali pranayama once again. Hold the tongue, जीभ को फोल्ड करना है और श्वासों को लेना है गले से कराटे मारे आवाज स्लोली करते हुए जल अंतर बंद गणेश को सुनवाना कंठान संकोच को जेतु श्वास को दिवा लोग आपादु जल सिंधुदिगा नाट्य द्वारा प्रतिपादित हुए Prasna Siddhasana Sukhasana just concentrate on breath. Now get ready for a beautiful pranayama, Bhramari pranayama, Shanmukhi mudra. Index finger on eye, middle finger on nostril, ring finger down the nostril, index finger down the lip, and take a deep breath and close with both the thumbs and make the beat sound. Relax. After the Bhramari pranayama, your body and mind both will vanish, take control and totally body and mind ready to do that meditation. Dhyana, Dhyana mudra. Think of the index finger and thumb. These two fingers should touch. Rest on your Dhyana.
Now relax all of you. Now the time has come for our awareness program on COVID-19, and today we have our faculty Dr. K. Sri Krishna, who is one of our senior most faculty at Gandhi Naturopathic Medical College. So he will be conducting the awareness program and acupressure and COVID-19, its prevention, mitigation, and rehabilitation. How acupressure is useful in getting relief from the COVID-19 symptoms. So he'll be teaching you certain points which you can easily at home press and get relief from your symptoms. Now over to Dr. K. C. Krishna for his presentation.
Hello, good morning, sir, and a very good morning to all the sadhakas. Today we will be knowing about the importance of acupuncture in dealing with the present COVID situation, keeping in mind the improving our immunity and fighting against the uh, respiratory ailments. So these are the two factors playing a role in present pandemic. So we can start with our acupressure therapy in dealing the present pandemic situation. So basically, you should keep in mind that the simple acupressure is a very simple subject. It is also known as acupuncture without needles. So before that, we should just understand that there is a lot of there is energy flowing through the body in the form of around 14 meridians. Meridians mean these are pathways. They will be flowing through the body. So the energy flows throughout these meridians so that the patient will be hale and healthy. So any disruption in the flow of energy in any of the meridian results in disease or diseased condition. So we have to correct it. So how we can correct is that by way of removing the obstruction. So that can be done by way of simple pressing some points that is known as acupressure. So acupressure points. So if you can press some, so best you can see the slide. Acupressure is a form of alternate therapy in which manual pressure is used to stimulate certain points to the body along the lines of the meridians. So any disruption in the energy flow can be removed by simply applying manual pressures. So next, by manipulating these points, we can strengthen, disperse, calm the energy, help it to flow smoothly in the body. So these are the benefits of acupressure. Acupressure is also considered as acupuncture without needles. So anybody can practice at their home, at their convenience. So no need of any doctor or therapist, but it should be done under guidance. So what are the benefits we can get is regular stimulation of these acupressure points that helps to improve the immunity. So that is the present hot topic about. So a lot of people are very low in vitality or immunity. So by manually stimulating or pressing some points, we can improve the immunity so that we can get some energy to fight against the current pandemic. Next is the homeostatic regulatory effect. So it calms down all the energy levels in the body so that all the associated symptoms, whether it is gastrointestinal or respiratory ailments associated with present COVID situation, that helps to benefit in fighting against the pandemic. So analgesic effect mainly nowadays we complain of all the body pains. Even that also one of the symptoms we get severe body pain. So by pressing these pressure points, we can get the best analgesic effect, means pain relieving effect. Next is the sedative effect also. We feel very calm, very fresh, very peaceful. So that is what we needed when we succumb to our undergoing this corona crisis, or when we tested positive. We feel lot of pain, lot of disturbance. So what we need is sedative effect, so that we feel very much helpful. So we feel very calm, very relaxed, and also psychological effects that also very important. So presently we are under a lot of stress and psychological stress by seeing the newspaper, by listening to the news, or somebody is really affected. So he'll be so much of under stress. So we need to balance his energy levels. So that's what we get. Good psychological effect, it will calm down the mind. And motor recovery effect also. We get sometimes somebody is painful conditions, or somebody is associated with any respiratory ailments that can be reversed back. So these are all very much helpful under present situation. So by simply pressing some points, we can have very much good effect. I will show it. Very simple point. First, you can look at the slide. Then first point is the large intestine 4, LI4 it is called. You can see the photograph. It is present in the hand region, where when the thumb and first finger, index finger are adducted, come together, the highest point of the intraosseous muscle you can see there. So that is the best immune improving point and analgesic point also. Means pain relieving. Somebody is having lot of body pains, weakness, you can press these points. So this is the best immune point as well as best analgesic point. So you can see the location. So the duration is also like you can continue press it for around 2 minutes. So on and off. But you should not remove the grip. Then take a break for around 30 seconds. So that way we can stimulate these points. LI4 is the best immune improving point, and as well as for the body pains. So you can simply do at your home by looking at this photograph, and there is no harm in it. You will not worry about there are no side effects. You'll only get the very good effects. Okay. Next slide we'll go for LI11, large intestine 11 point. You can see the photograph when the arm మోచేయి మడమ దగ్గర ఉంటుందన్నమాట. ఇది when you hold your arm, it's a lateral end of the elbow crease. So ఎక్కడైతే lateral end of the elbow crease దగ్గర point ఉందో మీకు కనిపిస్తుంది, you can see there. So this point is also very good for bronchitis and upper respiratory tract ailments. So presently so much of the lung is involved in this present corona pandemic. So we can help a lot by removing those mucus conditions or any respiratory ailments by pressing these points again for around 2 to 3 minutes and take a break. So this is also a best acupressure point for bronchitis and other respiratory ailments. So next point we can go for is, you can see the spleen 6. It's present in the leg. You can see around 4 fingers above the tip of the medial malleolus. Medial side of the chin ఎముక ఉంటుంది కదా, లోపల just to count the 4 fingers. And you can select this point. So this is also very good for homeostatic point and useful for general tonification. So improves our general health conditions, and it maintains the balance of all the energies. So somebody has got so many comorbidities also, like diabetes, hypertension. Those are all can be balanced by pressing these points, pressure points. So this also helps a lot. You can do your own by simply observing the photograph. Okay, next we can go for stomach 36. This is also very best tonic point, very powerful point we can say. It is present besides the knee. You can see the location. It is one finger breadth lateral to the lower border of the medial tuberous means below the kneecap onto the outer side. You can palpate, you can feel a bony projection. So that is one finger. Besides that, that is the location of the point. It is also very useful for all the comorbidity conditions, diabetes, hypertension, and even the GIT disorders. Nowadays, we are seeing a lot of gastrointestinal disorders associated with the COVID. So that also one of the conditions wherein so many GIT disorders are quite common. So we can overcome these kind of GIT disorders by doing this acupressure therapy. Something like nausea, vomiting, diarrhea. These are also one of the main symptoms. So even though there are no respiratory symptoms, of late we are getting these GIT symptoms. So we should be very, very careful, and we can get rid of these GIT or gastrointestinal disorders by following this acupressure therapy. So this is a very powerful point. All of you can note it. Okay. Next we'll go for other point is present on the finger. This is a point TW5. It is around 3 fingers above the posterior wrist crease. You can see the wrist crease. 3 fingers above the posterior wrist crease, in between the radius and ulna means two bones present in the hand. So this part is very helpful for motor functions of the upper body. So it can give very good nervous supply, improve the nervous supply, motor functions of the upper body, like those are all present in the lungs as well as other upper half of the organs. So again, pressing these points for around 2 to 3 minutes and take a break for around 20 to 30 seconds. Then again you can press these points. So this also will be helpful for improving the symptoms related to the upper half of the body involving lungs or even the facial related ailments. Okay, next we can go for CV17, conception vessel 17. As you can see, this point is located in the center of the sternum. Sternum is the bone present in front of the lungs. You can feel by just palpating here. So that's the bone, and in between the both the nipples at the fourth intercostal space. So this is the CV17. So this also pressure should not be given very high because it is near the soft organs and very important sensitive organs. So this is also very helpful for all the organs present around the point, like respiratory system or lungs. So especially useful for bronchitis and upper respiratory tract infections. So of late we are seeing lot of pneumonia conditions. So associated with the lungs. Any disorders can be overcome by pressing these pressure points or manually stimulating. So we can overcome associated with the respiratory ailments like bronchitis, viral pneumonia, whatever. This will be of immense help when you do this pressure therapy in this particular point. So again, be careful that you should be able to do it not very hard. So one of again some important points you can keep in here. You should not do it on empty stomach. So you can have some breakfast or tea with some biscuits or any fruits. So it should not be done on empty stomach. And it can be acupressure treatment can be done maybe once or twice a day also. You can do this treatment for 10 to 15 minutes. This will be very much useful. And somebody is very weak, somebody is very associated with a lot of hypertension or heart problems. So better consult a doctor before doing this. And if you feel any discomfort, giddiness, so better stop immediately and lie down and take rest to avoid any further complications or so. So all the healthy persons can do it, and even somebody is recovering also, they can practice because there is no involvement of chemical or medicine, so there is no chance of any side effects. People will definitely get benefits by practicing these therapy. Is very simple and very easy. Simple points, all of you can practice and you can get maximum benefit out of these simple pressure technique points. Hope all of you have understood. Thank you very much, and over to you, sir.
Thank you, Dr. Krishna. That was a wonderful presentation, short and sweet. I hope all the sadhakas might have followed these guidelines and benefited. So now we'll end the session with prayer. Over to Nilima and Girish. Before ending the prayer, I would like to advise all the sadhakas, whatever treatment modalities we are showing every day morning are in addition to the protocols which the ICMR has given. The government has laid on certain protocols. In addition to those treatments, and then adjuvant therapy, you can use these techniques. So healthy persons also can do these techniques, and the people who are having symptoms mild, moderate, they can also use these techniques. And for COVID rehabilitation, those who have recovered also can use these techniques. So there are simple techniques, acupressure techniques, which you can use at your home by yourself. So I hope that all of you will be getting benefited with these techniques. So thank you very much, Dr. Sri Krishna, for giving us a wonderful awareness session on acupressure and COVID-19, its prevention, mitigation, and rehabilitation. So now over to Nilima and Girish, our yoga gurus, for the end of the session, Shanti Mantra.
Start position, Anjali Bhakta. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति शान्तिः। To the body, keep on your eyes, slowly open the eyes, look your palm to the Namaskara and to the